And she is answering some of your questions out there now. Here's one that is on a lot of people's minds right now, Dr. Ashton. If my child is a few months away from turning 5, should I wait to get her vaccinated for higher dose or go ahead with the lower dose version approved for children under 5? Of course, that just happened, the new approval.
Absolutely, and I think that this is a really important question, and it's just the tip of the iceberg. A lot of parents are asking, what if my child is large for his or her size, 4, but maybe the size of a 5 or 6-year-old, maybe they're turning 5 or 6 when they're in the middle of their dosing regimen for the COVID-19 vaccine. Big picture answer is, this is not one size fits all, so you should obviously have a conversation with your child's pediatrician. However, in the pediatric world of infectious diseases, the general consensus is do not put off getting your child vaccinated because you're trying to wait for his or her birthday so that they could get, a higher dose, let's say for 5 or 6-year-olds. If they turn a different age in the middle of their vaccine, you want to alert the pediatrician to that because then they may get their 2nd or 3rd dose with a higher dose.
Oh, goodness.
Yeah, so it's not simple, it's confusing, it's stressful, but this is why this really should be a prolonged conversation with the pediatrician.
But certainly don't delay.
That is what the pediatric infectious disease specialists are saying.
All right, prescription for wellness on this Monday.
Yeah, so this is National Safety Awareness Month, among many health awareness months that we have in the month of June, and particularly slips and falls, which I was actually surprised is the 3rd leading cause of unintentional injury-related death in the country. So for all ages, 3 easy things that you can do to try to reduce your risk. Eliminate those loose rugs and carpets, whether they're in the bathroom or your home. Maintain proper lighting. One of my best friends, who happens to be a doctor, had a very bad fall going down a flight of stairs in the dark and wound up breaking her foot badly. And lastly, remove obstacles, clutter, and distractions. I'm guilty of this, TJ. How many times do you see me walking down the steps with one hand on the banister and this device in my hand? Don't do that.
Well, it's good to admit you're in that category. No, we are all guilty of that.
Even walking on the street, stepping off a curb, it's...
Oh, those are the worst. Seeing people walk, crosswalk, looking down, sending a text. Oh, all right, Dr. Ashton, thank you. Folks, keep your questions coming to us here at ABC GMA 3.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.